What's up, y'all?
This is Beyond 21.
I'm Caitlin.
And I'm Callie.
And this is Connie.
Hi.
This is our aunt and our family physician.
Yeah.
Nurse practitioner. So tell us a little bit about yourself, Connie.
I'm Connie Geimer. I live here in Cherokee County. I'm a nurse practitioner. I'm family, acute care, and emergency certified. And I've worked as a nurse practitioner since 2009. I've done emergency care, family practice, urgent care, and when I was a new grad nurse, I worked in a psychiatric hospital. So I have a lot of experience with our topic today.
So our topic today is going to be about mental health awareness. And since May is Mental Health Awareness Month, we wanted to kind of talk about that. So the things that we're going to be talking about today, we're going to be talking about like postpartum anxiety and depression, regular anxiety, depression, all those things. So we're about to get into that and get a professional to tell us all about it.
Okay, so since it is Mental Health Awareness Month, we're going to start off by talking about anxiety. And do you want me to do the stats first, or do you want to talk about the science behind it first? Or maybe how it's made you feel first?
It's made me feel, before I started taking medicine and stuff, I felt, I was anxious all the time. I really couldn't get my life in order. And I was kind of a big old ball of just, stress. It's kind of hard to describe now because I don't feel that way as much anymore. But like when you're all up in it, like it's kind of just, I don't know.
So you feel like medicine has actually helped you a good bit?
Oh yeah, it's definitely. I could tell a difference in it once it started like kicking in. I could tell like I wasn't nearly as angry as I was. And, I wasn't like freaking out over stupid stuff that I would normally like get stressed about. So
does the medicine take it all away, or does it just help?
Well, for me,
suppress the feelings.
For me, it takes, I'd say like 98% of it away, unless there's something major going on, and then I may get a little like bent out of frame. But other than that, like I'm pretty, balanced now. Like I can regulate my emotions better.
Okay. I have a little statistic here, and it's nearly 4 in 10 people, adults, reported symptoms of anxiety or depression in February of 2021 compared to the 32% in 2023.
So people are, it sounds like there's people kind of, it's getting normalized and people are getting help.
I wonder if the 2021 was still a COVID issue too, though.
She's going to talk about that some, so...
Okay.
Do you want to tell us a little bit about why that occurs?
I think that anybody that's probably over the age of 15 probably has some residual PTSD from COVID. We went through something as a nation that we had never went through before, and I think that people that were alive for the 9/11 attack, for the Oklahoma City bombing, for the first World Trade Center bombing. Everybody has PTSD because we're traumatized by those things. And, it's a very confusing time and we all get worried. And I think, with COVID in particular, like we were locked up in the house. We couldn't go anywhere. We had to wear masks everywhere. And, we're all Americans and we were not used to having any of our freedoms restricted. And we were also... there were a lot of people that were dying and there was just an unknown. So I think that really, everybody has some residual PTSD from that. And by that, I mean post-traumatic stress disorder, and that's a form of anxiety, which now then, I think that's going to have its own category. So.
I was, when I was writing up our outline for this episode, I've heard a lot of people on TikTok and stuff saying that like processed foods and the dyes, the artificial dyes or whatever that they put in,
the red 40s and stuff,
the red 40 and the yellow 5 and all that stuff, like that's, could be linked with issues of anxiety in children, like acting out and stuff. Do you think that's I mean, maybe not a huge part of it, but
Maybe not a huge part, but our diets certainly do play a role in anxiety. I think a lot of our issues now are cell phones and computers and tablets. I see a lot of kids that, like even small babies, they're reaching for the phone. And when we grew up, we didn't do that. And I think that, there's a constant stimulation, and we are constantly exposed to things because of social media. And we see things that maybe before all of these things existed, maybe we didn't see those.
That's true.
And I can certainly attest to the screen time thing, the TikTok anxiety or whatever. My story really started out during COVID when I had it, and I had to be out for 2 weeks at work. And there was nothing. I mean, I had watched all the movies I cared to watch on Netflix when I was out. And like 3 days in, I'm like bored. So I get on TikTok because this is right when it was starting to get, popular and stuff. And I get on there, and of course, they're like, oh, the Antichrist is blah, blah, blah. And the world is ending and all this other stuff. And it scared me so bad because I knew better than to believe that. But I was so isolated from other people. I couldn't talk to the one person that I knew would be like, hey, this isn't true. Don't listen to this, granddaddy.
Yeah.
And because I was like, I don't want him to die because I'm over here talking to him. And I didn't want, you know how I am with my, like, worries and stuff. I keep them to myself. I try not to get other people involved. So I didn't want to talk about it. And that led to, me getting worried. And I think that's why I, saw what I saw, that hallucination. It was already in my mind. And it just spiraled from there. And ever since then, I've been, until I started taking medicine, I was just all out of whack with my anxiety and stuff. So.
Connie, do you think that when people suppress their feelings, it makes their anxiety worse?
Yes. I think that, the treatments for anxiety is medication and talk therapy, cognitive behavioral therapy. And a lot of times people, some people are opposed to taking medications, and that's okay too, but they need to get help and they need to talk about it. And the other thing, to your point about watching TikToks, you have to be really careful what you watch. People put out crazy content, and my TikTok is filled with Bama Rush, monkey videos, dog videos, cat videos, makeup videos. I try and watch positive things. I don't watch political. I don't watch religious, because not everybody believes the way I do, and I don't want any of those negative things to be in my mind or worry me. And if it worries me, I scroll on.
Yeah.
And that's
what I've started doing is like, and I've realized that even if you don't like a video, you can, if you watch it for more than a certain amount of time,
it'll pop back up.
It will continue to come on your thing, even if you don't like it. So I've realized if I will look at not the comments, but the caption or whatever on it, and I see it's something I don't want to see, I will just move past it because I don't want the issues that I get from it. So,
and you can get on the wrong side of TikTok.
Yeah, you can. Yeah. You can definitely get on the wrong side of TikTok for sure. All right, so we're gonna let Connie tell us a couple of things here. She's got a little bit of notes, research.
So in general, the way that anxiety and depression work, they work in the same way in the brain. They work off of neurotransmitters. We have serotonin, which affects mood, sleep, and appetite, and a decrease in serotonin can cause depression and anxiety. Dopamine affects our energy levels and attention and our reward system. And then norepinephrine is our fight or flight. If you get scared, your heart races, and a lot of times the anxiety, we have a fight or flight feeling with anxiety. And then GABA, which is kind of our balance of agitation and helps us feel kind of calm. And then, there are a myriad of things that cause anxiety and depression, but some of the things can be just a terrible life situation, abuse, neglect, particularly traumatic events, major life changes, births, deaths, job transitions in life. And family members passing away. And then the other thing that I try and talk to my patients about is, like if you have children and you're anxious, your kids are going to be anxious because they, like good, bad, indifferent, children are a product of their environment. So, like if you're constantly helicopter parenting, like, oh, you're going to fall, you're going to hit your head, you're going to knock yourself out or whatever, those kids are going to be anxious. And then if you're anxious all the time and you express those concerns to your children, like, oh my gosh, what if this happens or what if that happens, they're going to be constantly worried about it. I see a lot of little kids that will come in here and they are very anxious, and I know their parents and their parents are anxious, and some kids just have anxiety naturally, but a lot of it is a product of their environment. So some of the basic symptoms of anxiety are physical things like heart pounding, shortness of breath, flushing, getting hot, um, and dry mouth, headache, stomach pain, nausea, diarrhea, and then a lot of the psychological symptoms are excessive worry, irritability, being on edge, having a lot of tiredness, your mind races, your mind goes blank, indecisiveness, difficulty thinking, difficulty concentrating, which is kind of hard because those are also a lot of the same symptoms of ADHD. So people really do struggle. And then there's some other things like behavioral things like obsessive compulsive disorder, avoidance. People that are anxious and depressed, they avoid their family, they avoid people. And then, there's a lot of different treatments. And what I would recommend is if anybody is struggling, go see somebody. What happened here back, I think maybe in, it was when George H.W. Bush, the second Bush, was president, there was some changes in the mental health system, and a lot of the state-run hospitals were shut down because they felt like that those were not good places for mental health. But at those state-run hospitals, there were a lot of outpatient programs, and so a lot of people that were able to get help were unable to get help. So after those hospitals were shut down, a lot of those people were put back out. A lot of people that were long-term hospitalized were put back out in the communities. They were put into group homes, and a lot of those people ended up being homeless. So we do have a mental health crisis here in America, and we are so consumed with other things that we're really not addressing it, or maybe we are not addressing it appropriately. Here in Cherokee County, we have CED, and I think that they have a provider that comes a psychiatrist that comes once a week, and we have a psychiatric nurse practitioner that works here. She's starting on April the 1st. And, like we work with, when I want somebody to, and we have counselors here next door to us, but right now we don't have very many resources here. And a lot of the people that end up addicted to drugs and addicted to alcohol, they are self-medicating for psychiatric issues. And, there are medications to take. There are the SSRIs, they're selective serotonin reuptake inhibitors, and they've been around for years. They work well. They're tried and true. They're inexpensive, so people that don't have insurance can usually afford those. And the SNRIs are effective, and they've been around for a long time, so they are very inexpensive. A lot of people want to take benzodiazepines, and those are not a good choice because they're addictive. They're a controlled substance, so go see someone and get help.
So I had a question back when you said, if you're struggling with that kind of thing, you do advise to get help. A lot of people, are either afraid or they just refuse to go get professional help. Do you think that getting just like a regular friend to talk to or like their parents, do you advise that? Because, sometimes maybe what the parent or the friend has to say can make them feel like they're being attacked, and make it worse.
I would go see like a medical professional. And
Yeah.
the reason is number one, even if you don't have insurance, I know here at our clinic, an office visit is very inexpensive. Like you can come in, be seen, get your labs and your prescriptions for less than $100. I know Christy Burt in Leesburg, same thing with her. Like the office visit is inexpensive. And I think the Perry Clinic has reasonable rates as well. So, like you can see somebody for inexpensive and you can get help. Now, the thing is, family members and friends, sometimes they really don't understand. And like they're not really, if you say, oh, well, I'm depressed, they're like, oh, well, just get over it. And then that leads people to feel like,
They don't matter.
yeah, and you don't do that to
Yeah.
people because whether or not and I'll give you my story. Like my first husband, I was married for 22 years, and we were together for 25 years, and he got sick and he died, and I was so upset. And like people were like, oh, he's in a better place, then you should just be happy that he's not suffering. Well, no, I'm not. And it's so hard when people dismiss. And
Your
I think
feelings,
that's the
yeah.
thing. And I feel like that people, the problem is that if somebody has diabetes or they have high blood pressure or they break their foot, they will come in and they'll say, oh, my blood pressure's out of control. I got to do something. Or they'll say, oh, my sugar's out of control. I got to do something. Or, oh, I broke my foot. I need an x-ray. But if they have mental distress, there's a stigma with that, and they don't want to come in and be seen because they feel like they're being judged.
I feel like they're crazy because I know that's how I felt. Like until I came and seen you, like was it been 2 years? I guess. You were the first person that made me feel like I was not crazy because I thought I was crazy, and I had, everybody's like, well, it's all in your head. Like get over it. Like I couldn't get over it because my mind just wouldn't let me.
Yeah.
Until you were like explaining the science behind it to me, you're like, this is why you feel this way because you're not the chemicals in your brain are not they're not right, and we can fix that. And like when I felt like I wasn't crazy and it could be fixed and there wasn't anything wrong with me, like it made me feel, I guess, seen and heard.
Yeah, and I think that's the other thing. And and what I would say to people, if somebody comes to you and they say, I'm depressed or I'm anxious, try to do it in a non-judgmental tone and just like listen to them. I mean, and if you don't know what to do, just say, well, I'm not sure what to do, but I think you need to be seen. And then like if anybody's listening, there are resources online. There is several, there's the National Institute for Mental Health. They have a really good website that has a lot of information and resources. If somebody is suicidal, you can dial 988 on your phone, and that's the lifeline. And there's also you can text hello to 741-741. Those are good places to start, and and get help. I mean, that's the biggest thing is get help.
Yeah. I had another question too. Like, if somebody just refused to go get professional help and they came to me to ask me something, or to at least just talk to me, when I talk back to them, do I try to match their emotions or do I just stay neutral the whole time? Because I don't, if I don't know, I don't.
I think just listening, and I think, if somebody's upset and you get upset with them, I don't want to say that necessarily you're feeding that, but I think sometimes, like, if you're at this level and they're at this level and you're both going to go up. So I think sometimes just listening in a calm tone and just, like, say, I understand, that's a big thing.
Yeah, okay.
Understanding is a big thing. And,
Okay.
We can't fix everything and we can't fix every single person, but sometimes just knowing that you're heard and knowing that somebody cares is enough. Some people don't even have that.
Yeah. And I feel like another thing when you said knowing somebody cares, that would be another thing, I guess, that if somebody did come to you, to constantly check in on them. Hey, are you feeling any better today? Or do you think that's a good?
Yeah, and encourage, and just don't be pushy, but be encouraging. So, maybe you should talk to somebody.
Yeah.
And, like a lot of times sharing personal experiences really does help.
Okay.
That's what I did. One of my friends had what me and her thought was probably postpartum anxiety and depression, and she knew that I took medicine, and like I was like the first friend out of our friend group that had to be put on medicine because of my anxiety and stuff. And so they will all like come to me and be like, hey, I don't feel right. What do you think? And I'm like, well, tell me how you feel. And if they felt kind of like somewhere around the same way, I was like, well, this is what I did and it helped me. So maybe you should go, talk to, which I referred her to Connie. And I was like, why don't you go and talk to Connie and see if, she can kind of figure out what kind of medicine you may need or whatever. And she ended up coming over here talking to Connie, and then she prescribed her, whatever she thought she needed. And she said that it's helped her out a lot. And she's like, I just feel
at
normal.
Yeah.
And I was like, yeah, I mean, and you don't realize how bad you may need the medicine until you get it.
And then you look back.
And then you look back and you're like, wow, I was like out of like I was a train wreck. Okay. So that's how I felt. And, I'm glad that she was comfortable enough to come to me and tell me, to where I could help her.
Yeah.
Without her feeling judged or felt crazy. Because I feel like if she would have went to, somebody else that maybe didn't have those issues, they'd have been like, well, it's just the baby blues. You'll get over it, whatever.
I feel like that's another thing, is like just sharing experiences with people. Obviously you don't want to air out everything you've got to just anybody, but sharing your personal experiences can help somebody, because you don't ever know what anybody's going through. You may think that I have it all together when really I don't. So I feel like sharing all that is a good idea, and it can help people open up as well.
Yeah, and I feel like
to get help,
checking on your friends, on a weekly or monthly basis or whatever, and be like, hey, if they may be struggling, or you think that, hey, are you? That's what I try to do. I try to be very conscious about checking on my friends, and I'll be like, hey, how are you doing this week? Are you okay? Like, and sometimes they check on me or whatever, but if I know that they may be struggling or whatever, I try to, go ahead and check on them and see if it will, if they're okay. So,
yeah.
And I think postpartum depression, that really needs to be addressed. That can be really serious. People, there have been some really bad outcomes from postpartum depression.
Especially recently.
Yeah, and so that really needs to be addressed. And dads can also get some postpartum depression.
I didn't know that.
Yeah, if there's particularly like financial issues, or if they have a history of depression or anxiety, like I was reading today, there's a website called postpartum.net, and they have a lot of really good resources for women that are postpartum, or are pregnant or worried about having postpartum depression. And they said that 1 in 5 men have experienced postpartum depression, but men are less likely to get treatment for any kind of anxiety or depression, because they want to be the strong, and like, we also, not only do we need to check in on our gal friends, we need to check in on our guy friends, and we need to encourage our guy friends, if they are getting treatment, to talk about it and make it normal. Like, people talk about their blood pressure, like, oh, I went and my blood pressure was 150 over 100, and I'm on some medicine now, my blood pressure is good. We don't have that same conversations about anxiety and depression.
Right.
All right, guys. Well, I think that's going to be it for us today. Just make sure to like and subscribe to our YouTube channel. I think there's a notification bell if you want to get notified when our videos upload.
And then check out our TikTok and our Instagram and all the forms that are in the description.
Yep. And then we've got some sources from Connie's research we're going to put in the comments. So, yeah. Is that it?
Yeah, we enjoyed having you.
Yeah, thank you for coming on here. Yeah. So just keep watching and liking and everything, and comment if you need help, and we'll send you in the right direction. If you're local and you're looking for a doctor's office, come here at Cherokee Family Health. Is that what it's called? Okay,
Yes.
I wanted to make sure
Yeah.
that was the right thing.
Yeah.
I was like,
And we have a lot of other good providers in this community. We have a lot of good people and good resources in this community.
yep, for sure. All right, guys, that's going to be it for us today. This has been Beyond 21 with Caitlin
And Callie.